I thought today I'd look at the posture of your upper body. So a lot of people who get backache in pregnancy, that's often not to do with the lower back, although that's where you feel it. It's to do with what's happening to the rib cage. So the classic pregnancy posture is that the ribs start to come out to create this space for baby, but as the ribs flare forwards, you're taking your body weight forwards into your feet and leaning back, which creates a bigger curve in your spine here, so that you get compression into your lower back, and that's often when you start to get the pain. So one of the things you want to try and work on is keeping your your ribs down, sorry. So instead of allowing them to come forwards and pushing forwards, keep thinking of the ribs as relaxed down. So baby doesn't have to come up there. The more space you give, the more space they'll take up. So if you keep your ribs relaxed down and work on the core, everything should stay neat. So you try and keep your hips and ribs about the same level instead of pushing forwards. But if you are getting back pain, sometimes just some mobility stuff around the rib cage and around the upper body can help. So that's what I thought I'd start with today. So this is good in the kitchen, on the countertop. It's good on a headboard of your bed if you're kneeling up on bed, or it's good on the back of the sofa or a sturdy chair that's not going to fall over if you push on it. Or anything that's sort of lowish. So because I haven't got anything, I'm going to use the ball on a chair, but this is also a really nice option because you can just rest on the ball in this position and just let your upper body go, and then you're not focusing on keeping your body upright so much. So this is a rest position that you can use. I'll show you it afterwards, but we'll go through the stretches first of all. So you're going to have your feet hip width apart, and you're going to relax back through the hips. So you just want to hinge back, but try not to slump over. So that's just going to make it just the same. We were trying to get out of movement through the rib cage and keep it steady. So the ribs and the hips are level as you push your bum back to then rest on the chair or the countertop, whatever you're using. So we'll start with just to thread the needle. So hands relaxed on that back, and then you're taking the arm through and then opening out to the side. So you want to feel that your whole upper body follows through and then open up. So you're not really moving much through the hips. They're nice and relaxed, knees are relaxed. So you're coming through and then opening up. So getting that chest stretch and then that upper back stretch. So it's not just about the arm. Don't feel that you're just putting the arm in and out. What you want to feel is that your whole body turns with it. So you're opening up the back and then opening up the chest. So you would do the same on the other side as well. Feed it through and then open out. So hips staying mostly still and forward facing the chair or the ball or whatever you're using. You're coming under, feeling that your shoulder is going to drop under and be level with the other one. And then when you come up, feeling that shoulder is lifting and being level with the other one. So that's what you want, that movement into the upper back, which should then give you a little bit of relief there. So these movements especially are good if you sometimes you can get sort of like a pain around the bra strap area. So these are quite nice for that. Lovely. And so after that, then you've got a full thoracic stretch, which is really nice. So you're going to step back a little bit more and hinge through, and then just allow your body to come down as low as you feel comfortable. So try not to make it your head going through. So think of your head to your tailbone all staying in a nice straight line, and then you're just pulling back and allowing yourself to sink through your arms to feel that stretch into your upper body. What you don't want to do is really tilt the tailbone up, because that will compress into your back as well. But also try not to tuck it under, although if you tuck it under here, you will get a back stretch as well. But if you tilt it up, you're just going to create a little bit more compression in the spine. We're trying to get out of that. So think of pulling back with your hips, feeling that stretch. And you can either just hold it and relax and breathe, or you can lift and lower out of it. So come up a little bit, ease off, and then take it back again, keeping the knees soft and relaxed. And then the other thing you can add in here is just turn and look underneath your arm, and then come back to center, and again turn and just look underneath your arm. And that's just giving a little rotation into that upper back. So again, lower back is staying still. Shouldn't feel anything going on in the lower back there, because your bum and your legs are holding you stable. The ball is holding you stable. So you're just getting that little rotation through, and that should feel really nice in that area. And when you're coming in, I would step in a little bit, tuck the tailbone under and curl up, and then you can get a nice stretch into that lower back. So then the rest position, if you want it. So all of these are things that stretches you could do during labour as well, in the first stage of labour. So anytime you're getting contractions, movement can sometimes help take your mind off it. So any of those stretches might be nice. Or you can just relax on the ball. So you could do this in standing, you can do it in kneeling, but you can just relax your upper body on. And in this position, the other good thing about this is then prime real estate for your partner to be putting a warm flannel on, or giving a little massage if you can bear it. And there's also quite nice little hip squeeze that you can do as well. So that's quite a nice position to rest in, and you can do any kind of hip movement here as well. So that's quite nice to end the stretches with. So hope you find those useful. Let me know how you get on. See you soon.